Ladies and gentlemen, earlier on there was a reference to the unbelievable significance of exercise, and Dr. Patricia Neumann, so keen on this issue, you remember she thrust herself forward uncontrollably. She's a specialist pelvic floor physiotherapist. That's one of those things you never really wanted to learn about. But we're going to learn about it today, and we're lucky to have her. She's a lecturer at the University of South Australia, and she is promising to do something unusual and physical at the climax of her presentation. So please welcome Dr. Patricia Neumann.
So, it's wonderful to be here today, and I'm glad there was a question before lunch, so I know at least one person's interested in what I've got to say. This is a bit of a tough gig straight after lunch, because this is the time when you've got your lunch in your tummy and you start getting a little bit tired and your eyelids might start closing. But don't, because I've got something for everybody. So not just those of you who are here with prostate cancer, but everybody else in the room as well, the wives, the partners, and anyone else who's associated with prostate cancer. So here's a pill. Looks pretty special, doesn't it? Pink, fluorescent, maybe a bit magical. Well, if I were to tell you that this pill could reduce your risk of developing cancer, could reduce your risk of developing heart disease and help you if you've got heart disease, can treat your type 2 diabetes, can help manage your weight, is good for dementia, is good for your arthritis, would you want to have it? Yeah. Sure you would, yeah. And if I told you that there are actually no side effects to it, that sounds even more appealing, doesn't it? Yep. And it doesn't actually cost much, about the price of a pair of runners probably. So I've given it away. This new medicine that there's been some fantastic research in the last few years, the last 5 years perhaps. So you're excused if you haven't heard about it. That is called exercise. So instead of going to sleep now, I want you to all sit up, take a deep breath, maybe even stretch your arms above your head just to show that you're all awake. Well done. And listen carefully to what I've got to say. And at the end of my talk, I'd like you to be able to say 2 things that you've learnt today that you didn't know, that you hadn't heard before. Okay, everybody listening? So I know that today's particularly about men with prostate cancer, and so I'm starting with the message that exercise provides benefits in quality of life, in muscular and aerobic fitness, and doesn't cause harm. And this is research particularly about men with prostate cancer. So what does that actually mean? Quality of life. Everyone talks about quality of life, but what does it actually mean? It's about doing those things that are important to you, that you want to be able to do, that you've enjoyed doing in the past and you'd really like to be able to continue doing. It might be engaging with your family. It might be hobbies. It might be out in the shed doing things. It might be being physical. All sorts of things that are going to contribute to your well-being. So what about muscular fitness? What does that mean? Well, it's about having strong muscles, muscles that are capable of getting you out of a chair without having to use your arms, or being able to climb stairs, or being able to lift your golf bag into the boot of the car and swing a golf club, or hit a cricket ball or a tennis racket. So having strength to do things, really important. Heave a ladder, whatever it might be. And aerobic fitness. We had a question about aerobic fitness, and that's the sort of fitness that gets us our hearts pumping and gives us the stamina to keep going, to keep up with our kids or our grandkids. So these are all the benefits that we can get from exercise, and the good news is they don't cause harm. Okay, so who's got an armchair like this at home? Mightn't be quite this colour, but a comfortable armchair. Yep, everybody. Do you know that these chairs are actually becoming the death of us? Yeah. We're all suffering from sitting too much, and it's killing us. Okay, be warned. Now, tucked away on the government's health website, there's all sorts of useful information about exercise. So this is a brochure that we've organised, and there are some out there on the table. So if you haven't seen them already, grab them before you go, because there's really important information here for you and for the whole family. More than half of all Australian adults are not active enough. Wow. So more than half the people in this room, or any group of people, aren't doing enough exercise. It gets worse. I think only 19% of people with cancer do enough exercise. Only 1 in 5, less than 1 in 5. So make your move. Sit less. Be active for life. Now that might mean, okay, so there's some specific guidelines here. So here we have the 18 to 64-year-olds. And in a nutshell, the advice in this booklet says, doing some activity is better than doing none. Okay, that's probably not too hard. There's lots of benefit in doing some moderate or vigorous activity, yep. And the more you do, the bigger the benefit. And the other thing is, the less fit you are, the more benefit there is in doing something. When you're at the top end of the range, it's actually harder to get even fitter, but if you're not fit at all, you can make a big difference by doing something. Okay, so you might have thought, well, I'm over 64, so this doesn't apply to me, right? Is that what you're thinking? Wrong, sorry. 65 years and older, there are very similar recommendations. 30 minutes of exercise on most days, and specific strengthening exercise 2 or 3 times a week. So they're exercises that are going to actually build some muscles. Doesn't sound too hard, does it? Okay, so make your move. Sit less, be active for life. So that might be getting out and mowing the lawn. It might be walking an extra stop. So I found this on a bus stop near where I live. It's from the Heart Foundation, who are giving us the same messages. Walk an extra stop. Regular physical activity keeps your heart healthy, not just your heart. It's good for lots more. It might be playing a game of tennis. It might be taking your dog for a walk. Well, I think you'd need to train your dog to walk in the same direction if you were going to be doing that. So, exercise and essential evidence-based medicine. Right, that sounds important. When was the last time you had a medical checkup? Probably not too long ago, right? Your annual health checkup. And I bet your GP asked you, checked on your blood pressure, right? Checked your cholesterol, yep. Maybe your blood sugar, maybe checked that you weren't smoking. Yep, true, all of those things. When was the last time your GP asked if you were doing the amount of exercise that's recommended by the national recommendations for health and fitness? And I'm not having a go at GPs here. There's this paper in the March edition of the Medical Journal of Australia was doctors talking to themselves about how good they are at recommending exercise. And they reflected on this and concluded that they're actually not very good at it for a number of reasons. One, they don't learn a lot about it in medical school, particularly if they graduated more than about 10 years ago. They learn a lot about pharmacology, but not a lot about exercise as medicine. Doctors, if they don't exercise themselves, are apparently less likely to recommend exercise to their patients. So another reason that wasn't in the journal, but I think is probably also relevant, is that there's not a big, powerful drug company behind exercise trying to sell it and promote it to the doctors. So it's the likes of me, a physio, or an exercise physiologist, and we don't actually have a lot of clout when it comes to advertising. So I'm glad I've got a captive audience today to be able to talk to about this. So I think don't wait for your doctor to ask you. You go along and knock on his door and say, hey, I want to have a health check and I want to know how I can improve my fitness with exercise and access someone who's going to help me. Now, okay, it's often a bit hard to get into exercise. It's a bit of a bitter pill to swallow sometimes. Hard to get started, hard to keep going. You need a bit of persistence and perseverance. It's sometimes hard to keep going when it gets a bit tough and you get a few joint aches and muscle aches and you start sweating a bit. For us girls, it doesn't do much for your hairdo either. However, it's a very important thing for us to be doing. Now, increasingly, authorities around the world are talking about exercise being medicine. Exercise is life, exercise is health, and there are health benefits with regular physical activity. So let's find out a little bit more about that. What can it do for us? Okay. People who are exercising are less likely to develop diabetes, half as likely. It decreases depression as effectively as medications or behavioural therapy. Now, this is not to say you stop your antidepressants and start exercising. No, but it is a very important way to help treat depression. There's an almost 50% reduction in the chance of getting high blood pressure if you're an exerciser. It reduces the risk of heart disease by 40%. It reduces the risk of colon cancer by a crazy 60% and lowers the risk of stroke by 27%. This is pretty amazing stuff, you have to admit. Now, I think this is a big concern for a lot of people, the dementia. Lowers the risk of developing dementia by a third and 61% lower risk of prostate cancer in people who exercise. Okay, pretty persuasive sorts of figures. So you might be asking now, what do I need to do? There might be some of you thinking, nah, leave me out of this. I've never been an exerciser and I don't want to know about it. But just hang in there because maybe there's something for you too. This is the recipe, pretty simple recipe. So here we have vigorous intensity cardio. So that's the sort of thing that really gets you pretty much out of breath and sweating. 20 minutes, three times a week. That's all you need to do. Or if you're not one for doing such vigorous activity, and there are reasons, medical reasons perhaps why you can't, it might be moderate intensive cardio. So that's stuff that makes your heart pump and gets you puffing a bit. 30 minutes on 5 days a week. That's a half hour, 5 days a week. Not much, is it? There's also a requirement to be doing some strengthening because getting your heart pumping is important, but you also need strong muscles. So twice a week, as a minimum, doing some weight training. Might be with weights, hydraulics, with TheraBands to build strong muscles through the body. So we need strong leg muscles to be able to get out of chairs, strong butt muscles, strong arm muscles, strong trunk muscles. So that's the sort of thing this is talking about. Now, this is a minimum, and if you choose or are able to exercise even more than that, even more remarkable things are possible. Can it stop the ageing process? No, sorry, it can't. Can't stop the wrinkles, can't stop the grey hair or the bald heads, but it can do a lot of other things that are very important to us. So let's have a look at these folk who have been exercising. So these are from the Masters Games in Aarhus a couple of years ago. So these are two 90-year-olds battling it out in the 100-metre sprint. Here we have an 87-year-old doing a nearly 3-metre, 2.77 metre long jump. And all he seems to have is a gammy knee. Not bad. Here are two 70-year-olds battling it out for the 300-metre hurdle event. And she's no spring chicken, is she? Nope. She's just set a new world record in shot put in the over 90s category. And here's a 70-year-old who's just set a new world record in the 10 kilometre run. So these are people who've really embraced exercise as a way of engaging with life and living life to the full. Okay, so let's think about exercise and cancer. Is there some way that we can apply this message to people who have cancer or are potentially going to develop cancer? And yes, there's a huge role. Exercise reduces the risk of a cancer progressing, any cancer. It reduces the risk of dying from that cancer, and it reduces the risk of that cancer recurring. In fact, it helps to reduce the risk of dying from any other cancer. Now, there are 60 studies, which is pretty good evidence from 60 randomised trials, that show that exercise can counteract the effects of cancer treatment. And we all know that cancer treatment can cause some very unwanted side effects: fatigue, muscle weakness, bone loss, etc. So there's very strong evidence now to show that people who engage in exercise can reduce the side effects of these cancer treatments, reduce the fatigue, improve quality of life, and also reduce the psychological distress, because it's stressful it's stressful having a diagnosis and then choosing treatment and going through that treatment. And that psychological distress can be helped by regular exercise. Also helps depression. And let's face it, a lot of people are going to have a problem with depression before they develop cancer. And so helping to deal with those combined effects, exercise can help that as well. And the whole stress of dealing with it, dealing with the medical profession and having to go into hospitals, it's a stressful time, and exercise can help with all of that. Okay, so how does exercise help? So I'm going to tell you a tale of two mice. I'm going to tell you two tales of two mice, in fact. So scientists have been trying to find out a bit more about what it is about exercise that helps, because we know it does. And so they've used these furry friends. So we've got the couch potato mouse on the left, and we've got the treadmill mouse on the right. And they found that the treadmill mouse is actually changing his body at a cellular level, improving his immune system, improving his glucose metabolism, building stronger muscles. And it actually has helped this mouse to reduce the growth of his tumour if he's got cancer. So it's actually reducing the rate at which this cancer progresses, which means exercise is assisting this mouse to longer survival. So that's a pretty good message. Now, I've got a second message about two mice, because there's some interesting research around pain, chronic pain. And I'm thinking, okay, in an audience like this, there are likely to be people who've got chronic pain, maybe as well as prostate cancer, but maybe partners and friends who've got chronic pain problems. And we've known for a long time that exercise is good for chronic pain as well. And we now know from science, from these furry little friends here, that the couch potato mouse is producing chemicals in its body which increase its inflammation in the body and make it much more sensitive. So if you give it a little electric shock on its paw, it goes, oh, that was terrible, and it curls up in its corner and feels really miserable. Whereas the exercising mouse gets the same little shock to its paw and gives it a little shake and keeps on going. It's not affected in the same way. So we know that exercise is changing things at a cellular level and benefiting us in all sorts of ways. Okay, so now to prostate cancer. And the good news is that at all ages and stages of prostate cancer, there's a role for exercise. So when can exercise help? And we're going to talk about some of these things in a bit more detail, but just a quick overview. We've already heard that it can help reduce the chance of getting prostate cancer in the first place. So also during chemotherapy or hormone therapy, in association with radiotherapy, around surgery, before and after, to help with bladder control and sexual function. If there's a recurrence of cancer, then it can help in that phase to deal with the recurrence and reduce the impact of it. And after the all clear, so that's that important phase when you've got the all clear, and it's about regaining your life again, working out what you want to do, having some goals and working towards them. And exercise can help with that. And then, of course, with many of the other medical problems that go along with just getting older or with prostate cancer. So the cardiovascular disease, the arthritic knees, the getting overweight, the memory problems. So all of those things can be helped by exercise. So we know that 3 hours of vigorous exercise a week in men with prostate cancer can reduce the likelihood of dying from all sorts of things. So even if you've got prostate cancer and you're doing vigorous exercise, it can have a very helpful impact on your longevity. So during ADT, androgen deprivation therapy, you'll read some places called androgen suppression therapy. We know that can be a really trying phase with fatigue and loss of vitality. And there's good, very recent, you'll see this is 2017 research showing that if men exercise during ADT, they're going to not get so fatigued and have more energy to do things they want to do. So this is a study of men who've got through their ADT and radiation therapy. And we know that one of the problematic side effects of this is the loss of muscle mass and putting on weight, as well as bone loss. And this study took a whole bunch of men who had had ADT and radiotherapy. Half of them got a pedometer and some good advice to walk, and the other half were put into an exercise program where they met 3 times a week, and they did some aerobic exercise and they did some strengthening. And they were in a group with an accredited exercise physiologist in this case, and they worked away for 6 months, and all sorts of measures were taken of their health the way they do. And at the end of 6 months, which group do you think were doing better? The second group, who were having supervised exercises. So just given a pedometer and some good advice, there was actually no change in the men's health. So the effect of getting into a group, having someone who knew what they were doing, giving you an individualised program so that you could work at your appropriate level, and supervising that had a remarkable effect on various physiological things. So their muscles were stronger, their weight, they hadn't put on as much weight, and they were in a much better mental state. They'd got a lot of support from the group situation and being able to interact with other men. So it had helped in many ways. So what sort of things were they doing? Well, they were doing some resistance training, which we talked about. So weights, squats, therabands, resistance elastic. And they were doing some high impact exercise like marching, jumping, hopping, skipping, walking, because we know that jumping exercises with impact, what does that do for us? Helps our bones, yes. We need that impact to keep our bones strong. So not very difficult things, and supervised by an exercise physiologist. Now, I thought it's probably a good time after lunch, because I can see some people starting to go to sleep, to actually try this. Now, if you were able to walk from the front door over to the lift, and from the lift into here and out to lunch and back in again, you'll be fine to do this exercise. So put your pieces of paper down, stand up. Yep, you've got to shift your trays, sorry. And what I'm going to get you to do, we're just going to do 30 seconds of marching on the spot. So just have a think, were you beginning to go to sleep a little bit? Yeah, probably. Okay, so if you feel that you can't do this, Stay sitting down or just stand and watch the others. So we're going to start just marching on the spot. It's as simple as that. Swinging your arms up and down. Don't fall over your bags and trip on somebody's handbag. That's it. Just keep marching. Breathe as you go. Don't forget to breathe. That's it. Keep going. How are you going? Good. Yep. Keep it going. Well done. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Give yourselves a clap. You've done well.
One health professional told me once, be fidgety.
So be fidgety.
Fidgety, yes.
Okay, that's good. So, one of the choices with prostate cancer is to have radiation treatment. And pelvic floor exercises are an important part of pre-treatment, potentially, to really get that bladder control as good as possible before going into radiation treatment. We'll talk about these pelvic floor exercises in just a moment. Prostate surgery is another choice for treating prostate cancer, and the choice to have surgery is a challenging one because of the risk of incontinence, which I think everyone's terrified of, and sexual dysfunction, which most men are terrified of as well. So what happens with the surgery is that the prostate gland is removed and the bladder neck here is brought down and joined onto the urethra here. And in the process, sometimes there's damage to the little muscles or the urethra, so that bladder controls may be impaired for a short time after surgery. For some men, it's a longer time. And we know that learning how to use pelvic floor muscles and training them can be a real help. Now, before prostate surgery, and someone spoke to me about this at the break, this idea of being as fit as you can going into surgery. So this is what we're calling prehabilitation. So not rehabilitation afterwards, but actually getting in beforehand and losing a bit of weight, getting as fit as you can, so that after the surgery, when you're discharged from hospital, you can get back on track and not skip too much of a beat in life. The other important thing to do pre-surgery is to learn how to use your pelvic floor muscles and to be confident that you know how to do this. My role here today is probably because I've got many years of experience now providing physio services to South Terrace Urology, where they've been doing robotic prostatectomies for the last 12 years, I think. So one of the pioneers in Australia. So I've got a long clinical career working with men with prostate cancer, and I've published research in this area as well. So here are these pelvic floor muscles. Now, it's tricky. You can't see them from the outside, can you? And knowing how to do these exercises correctly is a bit of a challenge, just because they're tucked right down in the pelvis. But you can see from here, there's quite a bit of, all this red stuff is actually muscle. So learning how to contract these muscles properly is something that a pelvic floor physio or a men's health physio will be able to teach. Now, one of the things that I've pioneered, and I'm really disappointed that this video clip's not going to work. I've just found out today. But one of the things that I've been using and have been pioneering is the use of ultrasound, what's called transperineal ultrasound, where you lie down and you have this ultrasound probe on your bottom, and you get this marvellous view, which we're not seeing too clearly here, but this marvellous view, this is where the probe is. This is the penis without the end on it. This is the prostate here. The bladder's just off the top of the picture here. Here's the bowel at the back. This arrow here is pointing to pelvic floor muscle as it's wrapping around the bowel. And this little white bit here is the striated urethral sphincter, which is your flow-stopping muscle. So that's that muscle that stops your flow of urine midstream. And when you're tightening this muscle, you see the penis draw in, you see this little striated sphincter move in, and you see the rectum lift up from behind. And I think actually seeing these muscles in action, given that you can't see what's going on from the outside, is a terrific reassurance for men who are going in to have surgery. And as I said, physios, and there are certainly some in Melbourne who are trained in using this, will be really important to see prior to surgery. Now, after prostate surgery, once it's healed nicely, so most surgeons will say don't do anything crazy for 3 weeks. You've got to let that join heal up nicely. You don't want it coming apart because you've decided to get out on the golf course too early. So, but once you're three weeks usually, some will say 6 weeks are up, it's about resuming exercise, and this is your chance to really get fit again or get fit for the first time. It's also a time when, if the bladder control's being a problem, to continue that relationship with a pelvic floor physio or continence nurse. Some of you mightn't have access to continence physios, but have continence nurses or prostate care nurses, to keep working to improve that bladder control. And it's also good for sexual function, so it does help erections. Okay, so what's the next step? Well, maybe you're at this phase of not being the vaguest bit interested in exercise and you've shut down and not listened to anything I've said. Yep, some of you are probably there. Maybe some of the things that we've talked about today will help push you into the next step, which is beginning to think about it, giving this exercise thing, some second thoughts. Maybe you're already getting prepared. Maybe you've already made some inquiries or bought that pair of sneakers to start walking. Maybe you're already in the action phase. Maybe you are already doing exercise, and maybe you're in the phase where you've been doing this for years, and they say it takes 5 years of exercising without relapsing to have a very good likelihood that you're never going to stop. So it's quite natural to get started and then relapse. You know what it's like. You go away on a holiday and you don't go back to that exercise class, or you stop the walking or whatever it's been. That's natural. But get back to it because it's really important to keep going. So we've got some brochures for you. There are also some, and this is the Choose Health, Be Active brochure from the health.gov.au website. And if you go into publications, physical activity, this is what you find. It's got all sorts of useful information, including this, this activity, Choose Health Monthly Activity Planner. So you can decide what you're going to do and you can tick off what you've been up to, and it helps you to keep going. There are plenty of options. Another one is exercise for people living with cancer, for family, friends, but for what to do if you've got cancer. There's also from Exercise Medicine Australia, there's a step count diary for the 10,000 steps program. Have you heard of that? Everyone's sort of getting mad about doing 10,000 steps, and it's quite a good way to be active, and it takes quite a bit of walking to do 10,000. Yeah? Now, this planner can help you to chart less than 1,000 up to more than 10,000, and you can write the days of the week and tick off what you've done. So it's a helpful way to keep your motivation up. Now, for those of you who don't want to go out and buy some expensive device to find out how many steps you've done, all our kids are running around with Fitbits, I shouldn't be mentioning names, sorry, are running around with devices to help monitor their fitness. But who owns an iPhone? Yep. Now, have you discovered this symbol on your iPhone? There's an app that comes with it that's got a heart on it. If you go into that, and I only discovered this a little while ago. I'd been hiking in the Blue Mountains for a week, and I came back and met up with a friend who said, well, how far have you walked? And I said, I don't know. And she said, well, it's on your phone. So I looked at my phone, which had been in my pocket, fortunately. You need it in your pocket for it to register. And I'd done 26,000 steps the day before, so I was pretty impressed. So it's a great way of monitoring how much you're doing each day and helping to motivate yourself. Two more there. So Pink and Steel International is an organisation with trained physiotherapists, all with an interest in helping people affected by cancer. So I've got on a slide, and a couple of slides, some resources in Victoria where you can access them. So they're physios trained. You can also, they're also exercise physiologists. So the take-home message for today from me, take-home messages, 3 in particular: get up, get active, and get help. Go see your GP and get a health check and ask to be referred to somebody to help you get going with an exercise program. So that could be a physiotherapist, one of these Pink and Steel ones, but most physiotherapists who've got a gym will be able to help you design a program, or an accredited exercise physiologist. So it's important that you go to somebody who's got proper training, and someone who's only done a short course as a personal trainer is not going to have the necessary qualifications to be able to assess your health and the state of your fitness. If you've got problems with bladder or sexual issues, a pelvic health physiotherapist, as I've said, or a prostate care nurse or a continence nurse, they're going to be people who are going to be able to help you in that area. So there's something for everyone. You can do it. And these are the resources for general exercise that are available here in Melbourne. Okay. Woo!